Welcome back to our special coverage of the COVID-19 crisis. Now, one of the hotspots of the pandemic in Israel has been the largely ultra-Orthodox city of Bnei Brak, which is just east of Tel Aviv. It has the second highest total number of cases in the country. The Israeli Defense Forces Homefront Command has taken the lead in dealing with the situation there. Yoav Limor, host of our Strictly Security program, spoke with the challenges with Colonel Avi Cohen. He's deputy commander of the IDF Crisis Center in Bnei Brak.
Colonel retired Avi Cohen, deputy commander of the Crisis Center here at the city of Bnei Brak. Thank you very much for joining me. What's the current situation here in Bnei Brak?
Now we are good. We took control of all the data, all the people. Now everything is under control, quiet. Everybody is very, very, very cooperative. We don't have any issues, special issues, and we contained the big problem that we had. And now we are taking control and start living under Corona days.
So before we reach the future of what's going to happen, which situation you received when you arrived here? When was that? About a week and a half ago?
We got here on Tuesday. It was a full chaos, you know, like you are coming inside a chaotic situation, like in a war, but not with the soldiers. Most of the people here didn't even know or understand the situation. They didn't hear about Corona too much. They are not seeing TV and internet. They didn't know about Rome and Italy and all of this. They were seated at home. They didn't understand what everybody wants of them. Very quiet, very good people, but they didn't got the information. So when we got here, everybody pressed us to contain the people. When I got here from my neighborhood in north of Tel Aviv, everybody was talking about they are contagious and they are killing us and people, and they got the epidemic around, and they are not responding to orders. But when we got here and we start to understand the problem, first of all, we understand they don't even know the problem because nobody got really to them. So we start mostly a lot of spokes issues, a lot of papers, a lot of talk with the rabbis, a lot of going with microphone and rhyme calls all over the city and start getting inside their heads that there is a problem. And it took like 48 hours until we adjust all the national system to Bnei Brak system. The system is very different. The change that connect them to the country wasn't there. So when we came as an army guys, first of all, the country talked different with us. We understand very good how to work with all the authorities in the country, know how the decision making is going. We got inside the city. There is a city mayor here, very active, very smart guy, very cooperative guy, but he need like a link. So we are like a link that sits in between and translate everything from here to there.
Many people rely on aid, food aid, medicine aid, etc., and you practically told everyone to stay at home. How do they eat? How do they get their medicine? How do they cope in their houses that are not built to host everyone at the same time?
We understand it in the most early hours. So we understand that if we get them food to the houses and a lot of talk with the people, everything will be quiet. We are giving now every day 16,400 food kits to every home. It's a lot of people. This is the difference. You cannot act here like in Tel Aviv. You cannot say to the people, stay home, and if you need something to eat, call to Pizza Hut and they will come. You cannot do it here because this is not existing here. So we start taking the population, a lot of information, a lot of data, and a lot of fusion of a lot of sensors and data. We built the population that we want to stay at home. 70 guys and older, sick people, contained people. We take all these people, we told them to stay at home, and first we start feed them. After we fed them and they saw that they can get food and nothing has happened, the sky won't fall of them, they become immediately very cooperative. And we have to keep it. It's a different kind of city.
But how long can you keep it? You know, they're here for about 10 days in that situation. Now it's Passover. Passover will pass in a few days. How long can you hold it?
We have a lot of thoughts and plans that we are now dealing with about how to get out. And we don't talk yet about the strategic of how to get out of Corona, but we talk how to live with Corona. And we know that to live here with Corona, you have to understand the system. For me, it's a system.
But there is an advantage here because they listen to the rabbis. If they get an order from the rabbi, it's a done deal.
Yeah, but the rabbis listen to their people. If the people are not comfortable at home, if the people are hungry, or they have a lot of problems, we know that the rabbi cannot resist their asking. We work very good with all the clinics, all the doctors. They listen to two guys, my doctor and my rabbi. So we cooperate together and we say that the doctor will say the same thing as the rabbi. He's speaking his word, they will speak their word. But if you cooperate together, they understand. We know it's tough. It's not easy to stay at home so long.
One of the issues that were spoken of is to take all the sick people out of the city and then leave here everybody who's generally healthy or that we know that they're healthy.
To take the sick people out is nice to speak about. It's a nice number to talk about. But you have to understand that it's not, if I have a father that is sick and a mother that is sick and they have 6 kids and they are not sick because nobody even, they test them. I cannot take the children without the father and the mother or the opposite. It's very difficult. Community is very close. We are trying and talking with them a lot. We have a lot of operation of convincing to talk with them, and we try to pull out most of the people that we can. But in the end, it's a balance that you have to take because we don't take anybody by force. It's rule number 1. We don't take anybody by force.
What can we study from the Bnei Brak case to other cities? Like we see Jerusalem currently, we heard of the city of Elad or Beit Shemesh, lots of maybe some Arab cities. What can you tell them looking from Bnei Brak outside?
You cannot order them like you are doing to regular people that are sitting at the TV and you make them afraid and they are doing what you had. You have to work differently. You have to monitor differently. And you have to get decision different. You have to talk with them. You have to understand that there's a lot of small issues that only their people, there are a lot of staff that we come and we ask the mayor, talk with them. He can do in half an hour what the country won't do in 2 weeks because he understands how it works. The first time that I think that they will look different at the army is when the army start bringing them the food. I think that if after we get out of the corona, the religious and the country will get closer, it's only because of this. It's a mission, you know, it's a one of a lifetime. I never had an opportunity to save so many lives.
Colonel Avi Cohen, thank you very much for talking to me.